global health could only be solved by generosity and philanthropy. You could have chosen to be in any industry, but you made a choice to do this. You either feed your family or buy medicines if you need it. You either clothe your children or buy medicines if you need it. We knew there was a challenge, there was an issue. What we didn't know was how much of a pain point, how frustrated. Before a patient gets to the need for medicines to get prescribed a drug, the chances of them failing or falling through that journey is very high. Today, as we speak, the average markup between the factory where the medicines are made and the facility is about 350%.
Why is it, in your opinion, that medicines for moms and children in particular are the most expensive in countries where they really need it the most? Hi everyone, welcome to the Born Into podcast. I'm your host, Isra, the CEO of Every Pregnancy, and I am so happy that you're here. This podcast is about something that impacts our daily lives, yet we rarely talk about it, the health of moms. Each week, we bring you stories of courage, crisis, hope, and facts from around the world about what it is like to be a mother, support a mom, or help a mom. On today's episode, we are going to talk about life-saving medications for mothers when they are pregnant, and how the experience of having access to medication is very different depending on what country you live in. Joining me is someone who's on a mission to change that. He's doing incredible work to make sure moms everywhere can get the medications they need. Let's welcome Emmanuel Akpakwu, the founder and CEO of Axmed, and a friend of mine who I recently met in Geneva, Switzerland at the World Health Assembly. Welcome, Emmanuel. We're so excited to have you here.
Thank you very much, Isra.
How are you feeling today?
It's great to be here. I feel fantastic.
But before we get into the medications and our life-saving services that your organization is providing folks, I want to talk a little bit about you and let the audience get to know you better.
Absolutely.
So Emmanuel, you said we're cut from the same cloth. I agree. There's a lot of similarities in our upbringing and our childhood. And I would love if you could share a little bit more about what brought you to be the CEO of Axmed and the founder of Axmed.
For me, the most pressing experience that led to the formation of Axmed was the fact that from a very young age, I spent time growing up in Lagos, Nigeria. It's a world where if you haven't been, would come across as a huge surprise, a bit of a shock to the system, in the sense that getting access to some of the most basic medicines is already a challenge.
Wow.
The result of that is that most people are faced with incredibly difficult choices. You either feed your family or buy medicines if you need it. You either clothe your children or buy medicines if you need it. And those types of choices are often driven by, let's call it, ecosystem shifts. There's a fragmentation problem that results in very difficult access to high quality medicines because individual buyers don't have the kind of scale required to get access when they need it. They can't negotiate on pricing effectively. And so they're forced to race to the bottom on price.
Right.
They'll go where they find the cheapest medicines. And very often those medicines are counterfeit or substandard.
Wow.
It costs lives. People have taken medicines and essentially lost their lives as a result of it. As a matter of fact, I think there are statistics that point to the number of lives lost annually on the African continent as a result of counterfeit and substandard medicines. And it goes into the thousands.
Wow.
So we're saying it doesn't have to be that way.
Right.
My 13-year-old friend who passed away taking poor quality malaria drugs didn't have to pass away. She didn't have to die so young. And that question resonated, it's been with me all the way through. Of course, moving to the UK, going to university, starting my first job, it was a question that kept coming up. Why is it that in a world where innovation exists, it's not like we have to make these medicines from scratch through research? They've already been made. Exactly. The research is done. But the access piece remains a pressing challenge. And on the other side of the equation, you do have high quality manufacturers who want to go to market with their products, but they face these barriers to entry because of fragmentation that make it very difficult for them to think about long-term strategic engagement in those markets.
Right.
We at Axmed are set up to help address those challenges. On the one hand, we want to aggregate demand and create a real one-stop shop so that if you're a healthcare provider or you're a buyer on the continent, you are able to express your demand, which will then be joined with others to build scale necessary to make you more attractive as a buyer.
Right.
And on the other side, on the supply side, high quality manufacturers no longer have to worry about racing to the bottom on price. They want to compete to win, in essence, those bigger volumes. So the price ultimately gets affected downwards. They see themselves as, being able to access a more seamless market with much more visibility on demand, et cetera, et cetera. And so they decide to capture that bigger volume, I need to be competitive on pricing.
Right.
That has a positive knock-on effect all the way down the line. So that's the sort of vision behind Axmed. That's how we got here.
That's incredible.
My personal experience obviously fueled the original mission and vision. And now we've built a team of people who are just incredible at making that happen.
Amazing. You were telling me you're up to 41
That's right.
staff members. And
That's
how
right.
long did it take you to build this so far?
So we were founded in 2023.
Wow.
Actually 2 years this month.
Wow. Well,
so
happy
we're just
2
2
year
years old.
anniversary,
Thank you.
Axmed. Shout
you
out to
very
all the
much.
Axmed staff and
All our Axmates
supporters out there.
Yeah.
We love that.
Yeah.
It's amazing.
Thank you.
In 2 years, you've been able to grow this fast. So how does it feel? How does it feel to be able to live this mission every single day?
We feel incredibly grateful.
Yeah.
I think above everything, the feeling is one of, we get to do this. We don't take it for granted. It's a real opportunity to spend our lives not just giving back in the sense that, has typically, been the case.
Right.
Through, kindness and your time, but through our intellect, through the
Absolutely.
business. And we're doing so sustainably, profoundly grateful to have the work, to have the community that we're building, and to have the support of those who believe that not just we, but access to healthcare can be transformed for the better.
Absolutely.
And we get to be a very small part of that story.
So tell us a couple of stories that you know from the countries you operate in.
We actually spent the first couple of years just building. We did so in partnership with healthcare stakeholders who both care for patients
Absolutely.
and procure medicines, but also with the companies who make those medicines. And, unusual for a startup to already involve users
Exactly.
at this early stage, but we did so because we didn't want to reinvent the wheel. We wanted to find those critical pain points that already exist and find the best paths based on firsthand user experience on what we needed to be doing to address those gaps.
I love that.
It took us a few months to bootstrap and kickstart. We were very fortunate to be supported by the Gates Foundation. And ultimately that allowed us to move fairly quickly, get the right people on board, build the technology. We were then further supported by a venture capital company based in Switzerland called Founderful. Plug.
I love a good plug. Shout out to Founderful.
Shout out to Founderful.
This is not sponsored by them.
This is not sponsored by them.
But we're still giving them a shout out.
That's right. But they believed in this model. They believed in us and they believed in my team. And we launched the beta version in October. We went live with the public version in February of this year, 2025. To answer your question, we are astounded by the pace of uptake because we knew there was a challenge, there was an issue. What we didn't know was how much of a pain point, how frustrated, how in need of an alternative most of these constituents that we sought to serve were.
Absolutely.
And the moment we came live, it was crystal clear that there was a real gap in access and care that we had the potential to fill, and that they were willing to give us a chance because we represented something different, something much more trustworthy, scalable, sustainable. It's worth noting for a moment that until now, there's been this, let's call it a false view that global health could only be solved by generosity and philanthropy. And I think that what we're now seeing is, even in that world of generosity, which of course is necessary,
Absolutely.
it needs to be paired with solutions that are sustainable.
Exactly.
That are able to, without the need to constantly get generous support, run businesses that are social enterprise minded, deliver return, but also impact.
Absolutely.
And that's precisely what we do.
You do it, and you do it to a T. And that is so clear that the focus of Axmed has been strategic, to be nimble, to be flexible,
right,
and move where the needs are. So, you were mentioning your friend who passed away at 13, which is the most unfortunate. But we know that there are so many moms and babies that are at every pregnancy, especially, that are passing away and dying in childbirth or in pregnancy from completely preventable causes.
Yes.
And one of them is lack of access to medications.
Yeah.
And so for you, why is it, in your opinion, that medicines for moms and children in particular are the most expensive in countries where they really need it the most?
The number one reason we see for that is the fragmented ecosystem. When you think about markets that have established processes to procure high quality medicines, and I use the word high quality on purpose because the cheaper, poorer quality medicines do exist. They're killing people. And so I use the word high quality because when you find a high quality local, regional, or global manufacturer, they need certainty.
Absolutely.
In the ecosystem. They need to be able to plan. They're not charities. They can manufacture products that could serve the patients, but they need to be certain of the ecosystem to bring those products to market. Mm-hmm. And certainty means a reduction in the fragmentation. It means the ability to get to the patient or to the healthcare provider in ways that don't cost too much. Today, as we speak, the average markup between the factory where the medicines are made and the facility is about 350%.
Wow.
That's right.
That's an unreal statistic.
It's surreal.
350%.
On average. Sometimes it goes up to 500%. I've seen cases where medicines made in Europe are cheaper in Austria than in Accra.
Wow.
And so Ghanaians are paying more for the same drug in Ghana.
Wow.
Compared to a wealthy market that's paying less for the exact same antibiotic or anti-malarial or anti-pain medication for the exact same drug.
The contrast and the inequity.
It's surreal.
I mean, it's fundamental institutional.
That's right.
It feels like robbery.
If we can remove that fragmentation,
right,
that benefits today lots of the middle players who essentially, because of the gaps that exist, have found novel ways to really extract value for themselves without really fully thinking about the impact downstream on the patients, then we can dramatically ramp up access or accessibility and bring down the price. The second reason is part of the reasons why fragmentation and sort of the middle players benefit is because when the buyer ecosystem is so fragmented, individual buyers don't have the scale to go directly to manufacturers. They need to find middlemen to work with, whether it's a retail pharmacy or a wholesaler or a distributor. They need to find a way to source their products.
Right.
No matter how big they think their demand is, a large-scale pharma company will not take that demand from a small player because that's not the way they work from a model standpoint. In order to make them attractive, they need to achieve scale. Scale has been achieved in the US. You have ecosystems that can reimburse for drugs, so it's clear how to procure them. Right. You can think about size differently. In the UK, you have the NHS. It's a single payer system. They procure medicines on behalf of the NHS of the country. And so you have scale. You can negotiate from a position of strength. Mm. In most growth markets, that scale is incredibly minimal compared to what you find in the wealthier markets. And so they simply can't be positioned to negotiate as effectively as they need to be. And then, of course, enter technology.
Right.
And we've enabled this scale factor become a reality. We take orders across multiple stakeholders. We've introduced, with our partners, end-to-end logistics to get the product to the very last mile.
Incredible.
We've essentially engaged high-quality local, regional, and global pharma companies, and we tell them, we bring demand to your doorstep. You don't have to go out there and knock on doors and find ways to reach those patients. We are now aggregating that demand, and it's coming straight to you. That reduces the barrier to entry. They don't have to go hunting for small tickets of demand across the board.
Right.
And we now represent a single port of entry with a much bigger scale. And of course, in turn, incentivize competition. That has changed the game completely in terms of access.
You've disrupted the system.
Indeed.
In the most powerful way. And we're going to talk about disruption a little
later.
later. You're just starting. Wow.
Yeah.
Really, what can one say when hearing how you all as Axmed are disrupting the way that it's almost horrifying to think about how the system has existed for decades upon decades. And in countries where truly need is only growing. The maternal mortality rate is so high. The neonatal mortality rate is so high, and it only increases. One thing that I want you to expand on that I think you've also learned to overcome through Axmed is being able to invest in the local leadership and the local economy. I'm sure pharma is not doing that. And I'm sure big companies could care less about local manufacturers and also the community healthcare workers that are at the end of the day implementing these medications, whether they're, prescribing them or actually physically implementing them as direct service. Why is that such an important part to the Axmed guidebook, strategy book?
So when we set up, we looked around at what others were doing.
Right.
And one of the big gaps that we found was across the patient journey, right? So the typical patient journey is, transportation to a facility, consultation, diagnostics, therapeutics.
Done.
Before you get to the consultation piece, most patients already back out because they say, it's too far. I can't travel 2, 3, 4 hours away from my village or town to the nearest facility.
Exactly.
It's either too expensive or I've got, home responsibilities. And so they don't even embark. They don't even start the journey. When they do, they have to deal with incredibly high costs to get a diagnosis. Then diagnostics, some patients don't even have what it takes to get there.
Wow.
And then therapeutics, which is where we come in. Before a patient gets to the need for medicines to get prescribed a drug, the chances of them failing or falling through that journey is very high. So if we exist to improve access to medicines for mothers and newborn children and patients across the disease area spectrum, one thing we have to do is to enable that journey become more seamless. We have a responsibility to the ecosystem, not just to generate a sustainable outcome from it, but to give and put back into a virtuous life cycle that supports it.
That's so
So what we said,
that's beautifully said. Wow.
Thank you.
I also want to do that with every pregnancy. I also echo
right.
everything Manny says. I just want to double down.
And I think you should. I'm going to hold you accountable to that.
Okay, I really am. The virtuous
cycle. Right.
Wow. Wow. Wow.
And so what we said when we started was we want to be a social enterprise. And we know people say this all the time. You can do well and do good, etc. But we want to put our money where our mouths are. And we said we will give back up to 30% of any profits we generate.
Wow.
Back into the ecosystem to enable the patient journey become much more seamless.
30%.
Yeah.
30% of your profits, up to 30%
of our profits.
You want to put it back in the system.
Into the ecosystem.
That's amazing.
We're going to constitute a board, an investment committee that will oversee how the capital gets redeployed.
Incredible.
And we are committed to ensuring that it delivers at scale solutions that reduce the barriers for patients across their journey. And that's the reason why for us, it became imperative to structure our setup to reflect that. In the US, we are a public benefit corporation, which means even though we do generate return for our investors, we hold our commitments to our constituents, patients and healthcare providers at the same level of importance. And we've now taken our bylaws from the US and we've incorporated that into our Swiss corporate structure.
It's incredible.
Holding ourselves accountable to the exact same mission. We're very transparent on the margins we put on the transaction to get the medicines into market. I mentioned earlier that it's on average 350%. We put 10 as a ceiling.
That's incredible.
So in cases, there are cases where we put less than 10. As a matter of fact, in some cases, we put 7 or 8 because we know the importance of those medicines getting into the hands of the patients who need them. And what that means is we're pursuing large-scale access. We succeed when we are able to get the medicines to the patients. And that success can only happen if those high-quality products are affordable and accessible. So that's the model that we've actually put forward. And we're very excited about it.
Disrupting the way that things operate in every way. And on that model, the technology, Emmanuel, behind the platform. We did a run through with it with our partners. It is so easy. It is so easy to get access to these medications for partners and organizations and even ministries of health, right? In different governments that you've been collaborating with.
That's right.
You have made it a seamless, accessible way and anyone from any country can understand and walk through. Talk about the significance of that access in the tech and how important that was for you to build that seamless and easy process.
Technology is only as useful as its usability.
Absolutely.
If we thought we'd built the world's greatest tech platform and every buyer failed to intuitively engage with it, then our mission fails. It sits at the core of our mission to build a platform, to build technology that is enabling. And I mentioned at the start that we sat down with users, with pharma companies, with buyers and procurement agencies, and we said, what are you faced with? What are your pain points? How can we be helpful to you? Rather than think about what we believe you need,
exactly,
and go away and build stuff that may not be as useful, we need your first-hand input on what we're building. And we were very fortunate that a lot of people said yes. We had stakeholders who, some of them based in Boston, large organizations that deal with healthcare procurement and serve patients on the ground across East and West Africa. And they said to us, we would sit with you and share with you some of those pain points and difficulties that we faced for decades. And we simply haven't been able to address. We're still lugging around Excel spreadsheets, sending these spreadsheets to different pharma companies to input pricing so that we can compare who's more or least affordable. Wow. And it was such a shocker for me.
That sounds painful.
Very painful. 3,000 rows. I mean, have you ever been through 3,000 rows in Excel?
Absolutely not. And I hope to never have been through 3,000 rows.
I wouldn't wish it on my worst enemy.
Oh my God.
It is a painful process.
Right.
And they've had to do this once, twice a year. They hire people just for that. And
I feel like you're shocking me with the behind the scenes.
I was shocked as well.
Let's keep the curtain closed sometimes. Emmanuel, we don't need to see all of this. 3,000 rows.
3,000 rows, more in some cases.
Wow.
And they needed systems, processes that reduced the workload, that gave them back more time to serve patients, that gave them more efficiencies in how they deploy capital, that introduced usability, intuitive usability to the process. And that was a challenge that we said we needed to fix, we needed to solve for. Needless to say, we believe we're well on that journey to doing it.
Absolutely.
We will never stop evolving the platform. Even now, we've taken on board the latest tools, hint AI,
Another plug.
Yeah, I know.
We're cool. We're up with the times.
We're up with the times here. We on the latest tools and built cutting edge features into the platform that allow both buyers and sellers to see the world of global health procurement in a very different way.
Absolutely.
And for us, that's incredibly exciting because we know that what we're building is not being built for us. There is a constituent. As long as they're happy, we're happy.
That's how I feel with every pregnancy, thinking through the ecosystem that we built with our partners.
Yeah.
This is not a fundraising platform. No. This is not a way for just having coalition to exist, to talk about advocacy and the things that we want to see different in the world. It is actually us coming together and committing on our mission and alignment to do it and showing up for it. Raising $21 million in 1 month of Ramadan fundraising. Fantastic. Just a little bit of flex. Just a little bit. I have to a little bit. Now talking to Axmed.
I think you should.
And I love that you encourage that. And this is the kind of, I think, partnership that thrives because we both see the gaps in the system. And we recognize that when you put the resources where they're most needed and through implementers that are most connected to the issues on the ground, that understand the cultural competency, that understand the communities in which they're operating, and you invest and empower them, that is the only way to build these sustainable systems.
Absolutely.
So I'm 100%. In awe of what you've been able to build. And I love that our collaboration is growing. So Emmanuel, where do you see Axmed in 5 years?
I believe we're going to be the largest medicines marketplace serving growth markets.
Let's go. Said here on the podcast,
right.
Born Into.
That's right.
What's the date today? Real quick.
It
July
is
3rd.
30th.
3rd of July.
3rd, sorry, yes.
He thinks we are 30th, time traveling.
30 degrees, I mean, it's 30 degrees.
Yeah, it's
outside.
true. Very hot in here. July 3rd, 2025.
Yeah.
I believe it too.
We on the path we've set ourselves on and the challenges we've set ourselves to addressing, it's going to be a tough journey, but I believe that we are, from a people standpoint, set up. Our mission and vision is crystal clear. We stand for the patients, for the buyers. We stand as enablers for the suppliers to get access to those high quality markets seamlessly. We are unlocking new markets for them at scale. We're doing so sustainably. We're enabling global development and funding agencies to deploy capital much more effectively.
Wow.
And we're shifting away from this, this structure that was underpinned for too long by just philanthropic capital, and now is being pairing philanthropic capital, which is incredibly powerful, with sustainable execution. I think that's the key. Absolutely.
And the blended financing of us combining our partners who mobilize from grassroots donors.
That's right.
37,000 of them in the month of Ramadan, giving by feeling motivated by the philanthropic dollars that we've seen institutionally to fuel this beautiful combination of this is the catalytic financing that we're seeing. This is what the vision should really be focused on. So figuring out these creative solutions is the way to run this. Emmanuel, I'm so inspired by you, like beyond inspired by you in many ways. And I feel like you're a mentor to me and the way that you've built your business, but also building the ecosystem. And one thing that we talked about last week that I think is really, really important, that I would love for you to share some thoughts with the viewers today, is around people power. And part of building a business and scaling it to the way that you have and building this ecosystem, because I think it's so much bigger than a business, right? This is an ecosystem, is about investing in the right people power. Internally and externally, including with your partners and the folks that you're working with, and the companies, the sellers, the buyers, etc. You said, I think something along the lines of, a company is only as good as its people and culture. And without the culture, and of course I'm botching this quote, by the way, but that's why you're here to correct me. But without culture, without culture being a key priority and a core foundation to the work that we're doing, then all else kind of fails.
Absolutely.
Let's talk about it.
I think it was a Peter Drucker quote, actually, which it's pinned on my wall in my office somewhere. And he says, culture eats strategy for breakfast. And what he means by this is very, very simple. You can build the world's best product, but if internally you haven't built an environment that enables people to be their best, that attracts the best people to work with you, that unlocks potential, that helps people feel, looking back and forward, that they're spending their lives doing something meaningful. If that culture that doesn't exist, if you can't talk about psychological safety and have candid conversations designed to driving an objective forward with people who are committed without a doubt to the mission and vision, then I think any company is bound to fail. And I think one of the things I see, and again, I was at a big pharma company before founding Axmed.
Right.
I came face to face with different experiences, leaders who taught me what not to do, leaders who taught me what to do and who inspired me to be the best version of myself, colleagues who responded to that leadership. But I think despite coming from a large pharma corporation, leading a large team myself, Axmed somehow feels different. It feels like I have the opportunity to set the groundwork, the foundation, right from the very beginning, and think very carefully about what it means to build an environment that enables people thrive. I could not be more convinced. I simply couldn't. That if I took a person who was considered mediocre, but with their heart in the right place and a sense of vision and mission, I will achieve more than if I had a person who was a culture killer, but who was fantastic technically. And I try to anchor on that. I try to find people who will say yes to the mission in a heartbeat.
Every day. Every
single day. Who turn up understanding that what we do is having a real impact on people's lives. And yes, of course, who themselves have to be compensated well and have to live, have a good quality of life, but who put that in many ways on par with their own sense of purpose and their own principles.
Absolutely.
So I feel without a doubt that, culture does eat strategy for breakfast, and Peter Drucker was right.
Culture eats strategy for breakfast.
That's right.
That's the quote, everybody. And I'm going to put it out in my office because I want to remember this moment and remember this advice, because I think you're right that we don't even recognize half the time the privilege to be able to do this work every day and be able to have a living from it, of course, is very important. But it is a privilege and it's a responsibility. And, there's a word in Arabic that we say called amana, which means that it's a beautiful word and it really means a responsibility. So this is actually given to you as a responsibility for you to be trusted with. And the idea is you don't screw it up. You do everything you possibly can with every access that you have, with all the resources that you have, with every part of your intellect and passion to do your utmost best in this role. And so I feel that from you, and I see that in the leadership you've brought to Axmed. And what an incredible mission you're on. I'll have a couple more questions for you, sadly.
With pleasure.
With pleasure. Thank you so much. We talked a lot about the successes and the incredible accomplishments that you've had in such a short time with Axmed. But I know there's lows in all of this, and I know there's challenges, but even from a personal standpoint, I get sometimes overwhelmed and thinking, can I really do this? Are we really going to achieve this? And the stress day to day between managing people and team and growing and scaling, it's a lot. So how does Emmanuel navigate all of that as a CEO, but also in his own personal capacity as an advocate and a champion for medicine?
That's a big question.
And health.
I think it's a very important question.
It is.
Undoubtedly, every startup founder faces
absolutely
very, very trying times. You're dealing with your idea from concept to conclusion or launch. And nobody believes in your idea more than you do.
Yes.
And then you have to convince them to believe enough of what you're saying to be supportive of it. When I was working early on in my career, I had a mentor who said something to me which stuck. He said, there are 3 C's that will follow you through your life. It's choices, chances, changes. At some point, you have to ask yourself, what choices am I making? And what impact will that have on my life? Those choices will range from very easy to very difficult and very complex. And there is a correlation between difficulty and complexity, and I don't want to use the word greatness, but outcomes that defy gravity. And when you make that choice, you then have to take a chance on yourself. And those chances are chances that will scare you. And they should, because if you've made choices that push your boundaries capability-wise, then you have to take a chance on yourself. Sometimes when nobody else will take a chance on you.
Absolutely.
And as a startup founder and a team of highly ambitious A-type personalities who want to change the world for the better, you will find yourself, once you've taken those chances, seeking support. You're seeking, in a way that's incredibly vulnerable,
right,
seeking outside validation. People who will say, you're not full of shit. Oh, yeah. Can I swear?
We can say that here.
Yeah.
This is the Born Into podcast.
Right,
we keep it real. Yeah, for real though. That's a really important point.
And so it's an interesting mix of self-belief, you're betting on yourself, but a desire to be backed. Taking that chance very often will mean making very difficult changes. Changes that you know are necessary to forging that path ahead. Sometimes those changes bring you from point 10 to point 4.
Yep.
It's like 3 steps forward, 6 steps backwards.
Absolutely.
And you're finding yourself navigating, asking yourself, did I make the right choice? And all these questions are questions that I've had. We bootstrapped to start with before we were supported. We bootstrapped with our own capital. We had no idea. We just believed in our concept and our model as a vehicle for transformation and change. But we probably, as many startup founders do, heard lots of no's before we began to hear some yeses.
Definitely.
And we found ways to support each other and power through. And I use the word we because even though the question is to me, I simply couldn't have done it by myself. I had to be surrounded by people who were willing to throw everything on the line to make this access story a good story, a story that actually came to life. Whether it succeeded or failed, we had to bring it to life. And I deal with these things on a professional note with the people that surround me.
Of course. I
think I am so grateful and so indebted to my 2 co-founders, Felix and Sophia, to my leadership team who've dropped everything to say yes to this. Amazing. These are people who could have taken jobs at Apple or the latest and greatest AI company in the world. And they brought their skill sets to partner and join forces with me to make this happen. And on a personal level, my faith. Everything I do, in my view, is a gift. And it's a gift that is driven by faith in something much bigger than myself. I simply would not be where I am today without that. And I find, some people have, other ways of handling personal trauma and strife.
Yeah.
But I found that in placing my faith in a higher being, I've in a way cheated. I've abdicated responsibility to some extent.
I've never heard someone say that.
Yeah.
That's interesting.
Because that almost weird to the world, at least at large, broadly speaking, belief that, God has my back, some being out there is looking out for me. It, in a weird way, frees me up from what I would think if I believed it was just me. If the buck fell at the end of the day with just me. And I think it's a bit of a cheat code. It's a hack that is predicated on something so fundamentally hardwired into my belief system. So when I have days that go incredibly well, as I do, and I have days that go completely shit,
Absolutely.
like I also do. I take those two as, in some ways, gifts. I don't take it personally. I am gutted. I am stressed. I am exhausted. I am frustrated. All the human emotion comes out. But on a deeper level, I'm not worried because I trust that it's going to work out.
I can relate to that so much. Obviously, being a visibly Muslim woman and growing up in the US, dealing with discrimination, Islamophobia, people undeniably doubting my abilities, all because of what they visibly see. I don't know where I'd be without my faith. Like, that is truly the one constant that I've had. And I agree with you that just knowing that I have my trust placed somewhere, it is a cheat because I really don't have to worry about it.
Right.
I'm like, it's going to work out. They're like, where do you get your optimism from?
That's
I'm
right.
like, my faith.
Yeah.
Where do you get your joy from?
Yeah.
I'm like, my faith.
Yeah.
I'm like, but that really is such a blessing and a privilege to be able to carry that. And it is tested in so many different ways. And I would even expand on, you know, I am a mom to a toddler and you're also a dad to a toddler.
That's right.
And we love our toddlers. They're very close in age, which is incredible. Just another thing that, you know, we found relatability in Geneva. And I also feel like I look at my son every single day and I say, I do this for him. I do this because I want to make sure no mom that also is trying to carry a child into this world that also will struggle with pregnancy in the way that I did, but didn't have access to the care that I had. I don't ever want to see a family torn apart like that. I don't ever want to see a mom not survive, a child not survive, and that bond that will never be formed because of preventable reasons. So I know that I look at my son and he's a reminder of my mission. And I know that we even deal, right, with, at least I deal with mom guilt. So you do dad guilt with the pressures, responsibilities, and traveling of our work. And it's a constant reminder that actually they are our North Star. And what we're working towards is a better world for everyone that looks and feels just like them, that wants that relationship with their mom and that survival and their dad, especially, of course. Anything that you want to comment on that?
I mean, I could not be more eloquent. I think you've said it.
Thank you so much. That's so kind.
You know, you have people who hold you accountable in a very powerful way. I think both our kids unlock a new way of seeing the world.
Absolutely.
And, you know, of seeing pain and injustice. And as a Christian man sitting right next to you, I can tell you that that is one thread that cuts across both our belief systems. I mean, many threads do, of course.
Of course.
We have a debt, and very often I think, and this is a personal view, but I think that debt becomes much more crystallized when a little human comes into the world.
Absolutely.
And you begin to see the world through your experience. Are other children struggling to get access to healthcare? Are other mothers who've been through what you've been through, and thankfully, successfully,
thank God,
at risk of losing their lives, or are their babies at risk of losing their lives? It personalizes global injustice in ways that you simply just can't shake off.
No, you can't.
And, you know, I feel, a part of me feels incredibly grateful that, again, we get to do this work so that we can explain to these little humans as they grow up that part of your existence should be in service of others, if not all of it.
Absolutely. And especially in the world that we're witnessing today, where there's tremendous injustice. Everywhere you look. And we recognize that it is on us as individuals and as a collective to do everything we can in the lives that we're living to not just remind people that these crises are happening and that people are being killed every day and that moms and babies and families are being starved every day, but that we have a responsibility to do something about it.
That's right.
So I'm just, this is like making me a little bit emotional thinking about this and talking about it with you. Emmanuel, I want you to finish this sentence. No mother should ever
have to struggle to get what she needs.
Beautiful. Impactful.
Yeah.
And yet so many are.
Yet so many do.
And, I think one of the last things I want to end this conversation on is talking about our own moms. And I know that you're a big fan of yours, of course. I saw some social media love
That's right.
for her, and I love that. And I'm a big fan of mine.
Yeah.
Having 7 children,
Yeah.
raising them in a country far away from Syria, here, giving us every opportunity to thrive.
Yeah.
Having those 7 children, carrying each one to term and raising them, toddlers attached, getting pregnant
That's
again.
Right. Yeah.
Shout out to my mom. She's
huge shout out to moms everywhere.
To moms everywhere. Your mom,
mom,
everyone.
Look.
But did your mother ever imagine you leading a global medicine platform that is changing the ecosystem, that is disrupting the world that we're living in? And what hopes did she have for you? And because I know my parents wanted me to be an architect.
Well,
and then my mom wanted me to be a dentist.
Yeah.
And clearly I'm far from there. But she's very proud.
There's a well-known cliche about Nigerian parents.
Oh, what is it? Tell me.
And they say you're either a doctor, lawyer, engineer, or failure.
This applies across the board.
Basically.
I think all brown parents, all immigrant parents, but for sure.
I wanted to study economics, and my dad said, well, what are you doing studying economics? How's that going to help you?
Wow.
And I said, well, I'm passionate about it. I was like, well, if you want to study economics, you can go ahead.
Yeah.
But I just will not pay for your tuition.
Yeah.
Wow. Like, wait, what? And he was not kidding. So I did computer science because my dad genuinely did not believe that economics was helpful.
Yeah.
Bless him. He wanted the best for me. Of course, I wouldn't do the same thing to my son. Yep. And my dad loved me and I loved him. But at the end of the day, the reality is parents all the time, every parent wishes for their kids to become, they see their kids, first of all, as the best thing since sliced bread. And my parents were no different. My father's passed away now a few years ago, but my mom, from a very young age, the one thing she did for me was she never put her own vision of the future as my roadmap. And she had this kind of weird blanket support system that whatever it was I chose to do, she just was supportive of it.
I love that.
And I always found it fascinating because I could say to her today, I want to be a dentist, and she'll have the exact same energy as if I said tomorrow I want to be a vet.
Right.
And at some point I was like, well, pick a lane. Like, what do you want? It's like, so, but what that did to me or for me was it made me believe that somebody had my back here.
Yeah.
No matter what I chose, she would find a way. Yeah, that's right. She would find a way to let me know that I could get it done.
I love that.
And from a sort of growth psychology standpoint, this changed the game completely for me.
That is incredible. And it's exactly the type of mentality I want my son to grow up with, knowing that mama's got his back, no matter what he decides to do. As long as he's a good thing.
That's a good thing. Yes, I was going to say.
Okay, well, we'll also hold you accountable, Mom.
So we're going to hold you accountable. Here
that's
right.
20 years when you watch this podcast, you're going to see I'm going to hold you accountable. Yeah. But I will support your dreams.
That's right.
In any which way they come.
That's right. Yeah.
And I had to navigate a little bit in terms of moving from the architecture to hopes of a dentistry because I have good teeth, which I was like, shout out to all the dentists out there. It's just not my thing.
Yeah, yeah.
To now where I am and finding. Thank you very much. Mama. It's all for you. Yeah.
Kudos, Mom.
But definitely the world that we're living in now and the work that we're doing now, I know our parents could not be more proud.
No.
And it is a beautiful, beautiful thing. Yeah. And I'm so grateful that you have that support system. Emmanuel, okay, this is like the end of our conversation, which is really sad. Yeah. I kind of don't want to stop.
I know. I think.
How many hours?
Can we do another 3 hours? Okay.
Yeah. No one wants to listen to a 3-hour podcast.
No. Yeah.
I mean,
20 minutes.
Maybe if you're with Bill Gates, like we're just chatting with him.
Maybe. You never know.
Maybe you could interview him next. The sky's the limit. What are your final thoughts for our viewers listening in today?
I think, first of all, a huge thanks for the opportunity to sit with you and have this great conversation.
Lovely.
For our viewers, you need to know this. it is possible to address the tremendous access gaps that exist today in the growth world. 6.5 billion people live in countries that we consider to be low or middle income. They struggle to get access to high quality medicines. Over the past 3 decades, over 99% of the additional population added to the world has happened in these low and middle income countries, placing undue strain on already struggling communities and ecosystems. That has to change. If we're going to be 9 billion people by 2030, we have a responsibility
Absolutely.
to making sure that healthcare equity gets off the pages of being talking points and gets into the lives of people every single day. So, on that note, thank you so much.
Beautifully said. I think I speak for both of us, Emmanuel, when I say that we are so excited about this partnership between Axmed and Every Pregnancy that aims to change the story for mothers everywhere, no matter where they are, no matter where they're born into, what circumstances they're navigating, we're here for them. Yeah. So for our listeners, if you're a policymaker, a funder, a healthcare worker, or someone who has lost a loved one because the system did not show up, this is your moment. Follow us at Every Pregnancy and at Axmed_AG on social media. Don't get it wrong. And visit everypregnancy.org to learn more, sign up for updates, and join us in making every pregnancy safe. Let's go.
Let's go. Woo.